I think it's important to say that the health crisis that we have, the trolley crisis that we have on an annual basis, is not a natural disaster. It's not a natural function of winter. It is a policy-made disaster. It's a policy-made disaster that we get on a regular basis. And those policies are a commitment to a two-tier, fragmented health service with a chronic lack of capacity and staffing in emergency departments, in acute and elective hospital services, in ICU, in public health teams, in primary care and GP services, in mental health and disability services, and step-down, nursing home places and home care, and more. It's a commitment to continuing a for-profit part of our health service, and the for-profit part of our health service only exists if there are problems with our not-for-profit parts of our health service. And then finally this year, on top of those annual problems, we do have an extra problem in terms of policy to do with COVID, where the government did not take the continuing threat of COVID, and on top of that, of course, you have the flu, you have RSV, seriously enough. There isn't anywhere near enough of an effort in terms of promoting the use of masks. I think we should be listening to the likes of the INMO, to the likes of the unions representing bus drivers. There isn't still action in terms of ventilation, filtration in our public buildings. I saw a picture earlier on from Davos, where there was a number of world leaders sitting down having a conversation. They had HEPA filters in front of them because it works and because it has an impact. And so this added to the crisis. So it's policy driven. It does not have to be this way. And I do feel that often in the conversations that happen around the regular health crisis, there is an attempt to obfuscate and to present the whole thing as kind of more complicated than it really is, and just beyond anyone's understanding. It's just, we just keep giving money to this thing and it still doesn't seem to work, you know? Just to make people think there's nothing that can possibly be done about it. And of course, there are complex parts about it. Of course, there are issues in terms of structure and so on. But at the very basic basis of the health crisis that we have, that it particularly expresses itself every winter, is a basic issue around capacity in terms of beds and staff to go with those beds. Where in the early 1980s, Ireland had 17,500 hospital beds in our health system. Today, bed capacity is just over 11,000. That's the same as it was in 2009, when we had a population that was 500,000 people lower than it is today. And that's at the core of the crisis. In my opinion, that's the most important fact that explains why we have the crises that we have. You compare hospital beds per 1,000 population of this country, 2.9, to the EU average, 5.3. We're little more than half of the EU average. And an extra 5,000 hospital beds are urgently needed in the public health system to address this core capacity problem. And then the other side of this is the enormous profits that are made in private healthcare in this country. Vast amounts of public money are being drained off into the private sector, which also benefits from massive tax subsidies. 3 weeks ago, Larry Goodman's BlackRock clinic reported a doubling of profits to €14.5 million on revenues of just under 160 million. This profiting from our health crisis must stop. We should stop having a public health service that is underfunded, under-resourced, and then allows the private health system to operate. And the private hospitals should be absorbed into the public system to contribute to the extra capacity that we need. We need to take these into the public health system. We need to build an all-Ireland national health service. I finally want to say a couple of sentences in relation to the possibility of industrial action by the INMO representing nurses and midwives, because they are really on the front line, together with the patients in the hospitals, of the crisis that is of the government's making. And Every year, like, they're the ones that come out with the trolley watch figures. They're the ones that put this on the political agenda, put real pressure on the government. And every year we get the commitments to say action will be taken, this is going to stop. And yet it happens year after year, and it is now worse than ever. And so I think that nurses and midwives have been left with no choice but to take action. We can see from Britain, with a hard-nosed Tory government, that strike action by nurses have put serious pressure even on them to negotiate. Industrial action by nurses and midwives here would be enormously popular. I mean, I was on a TV programme, they asked people to text in, and it was something like over 80% of people said they would support strike action by nurses and midwives. And it would have the impact of galvanising public support in a mass campaign to force the government to properly invest in our health service, to protect patients' lives and the working conditions of all those who are in it.